Hello, I just wanted to take a moment to go over the thyroid case studies. Our first case study was Marty. He is 24 years old. He has a bulge on his neck, which we know that bulge is called a goiter, so make sure you know that. And that's kind of all you get. You don't get any other information other than the fact that it's been growing over the past few months. The test for thyroid functioning is they take blood and then they measure the level of two hormones. They measure TSH, which is thyroid stimulating hormone, which is a hormone made by the anterior pituitary. The other thing it measures is free T4. Remember, the thyroid gland makes T4 and T3, which we're kind of lumping together as thyroid hormones. And these are modified amino acids, but remember they are lipid soluble. Let me get that better. And what that means is most of thyroid hormone is going to have a carrier protein. So we are measuring free T4 because that's what we can measure. So looking at these two numbers, the next question is, what is your diagnosis? So for that, this T4 is a thyroid hormone. So that's what we're going to look at to diagnose if the patient has hypothyroidism or hyperthyroidism. So if we compare Marty's values to the normal range, we see that Marty's thyroid levels are very high. So that's hyperthyroidism. So that answers our next question when making your diagnosis, which level will help you determine your answer. So the answer was high free T4. The next question was, which of the following are causes of hyperthyroidism? So in Marty's case, Hashimoto's is hypothyroidism, number one cause. A failure, so when you see failure, that means that that gland or that brain region, in the case of hypothalamus, is not secreting anything. So those are not good choices. Where you get hyperthyroidism is when there is a thyroid gland tumor that is over-secreting, excess anterior pituitary secretions. So that anterior pituitary secretions, that's like saying there's excess TSH, and we know our chain of command. So we've got the hypothalamus, so thyrotropin releasing hormone, we got the anterior pituitary, is going to release TSH, and then if everything's working, the thyroid gland will then respond. Okay, so if the anterior pituitary is over-secreting or the hypothalamus is over-secreting, you're going to get a lot of thyroid hormone. So this is going to go up. So excess anterior secretions, excess hypothalamic secretions, and the number one cause of hyperthyroidism is Graves' disease. So hopefully you got that one right. And then since we know Marty has hyperthyroidism, then it's like, what symptoms might you see? You may see what's called exophthalmos, and that's protrusion of the eyeballs, and that's due to excess pressure and fluids behind the eyes that make them push forward. We know that thyroid hormone has a calorogenic effect. And so it creates heat. So if someone has a whole lot of thyroid hormone, they're going to feel hot. So you're going to get sweating. It increases overall metabolism, so you're going to see a high heart rate. And the big thing that it does is it increases BMR. So we learned that that was basal metabolic rate. So high metabolic rate. All right, our other patient was Heather. She is older. She's 6 years old. She has swelling in her limbs and she's tired. So the same tests are ordered, And in this case, what we see is Heather's free T4 is low and TSH is high. So based on her lab results, she has hypothyroidism because T4 is low. And so that answers our next question. Remember, T4 is a thyroid hormone. TSH, who makes it? Anterior pituitary. And I'm sorry, I'm very bad about writing on my iPad. Okay, so our next question, based on Heather's lab results, does she have a goiter? You can have a goiter with both hyperthyroidism and hypothyroidism. What has to occur in order to have a goiter is that the thyroid gland has to be stimulated. So we go back up and look at her results. We see that she has a lot of TSH. So that thyroid gland is being stimulated. The number one cause of hypothyroidism globally is low iodine. And if the thyroid gland is being stimulated and it doesn't have iodine, it's going to try to build it, so there'll be a buildup of thyroglobulin, so you would see inflammation. The number one cause in the United States is Hashimoto disease, and another name for that is Hashimoto thyroiditis. If you remember from your anatomy physiology before, itis always means inflammation of. So inflammation is swelling, so yes, Heather has a goiter. The next question asks, is this primary hyperthyroidism, meaning a thyroid gland issue, or is it secondary hypothyroidism, meaning an imbalance up the chain of command? Usually secondary is going to be due to the pituitary gland failing. And so that's the reason that TSH is being measured to check on that pituitary gland, and also secondarily the hypothalamus, but we're not measuring thyroid tropin releasing hormone. So in this case, for Heather's results, her TSH was high and her free T4 was low. And so she had primary hypothyroidism. If it was secondary hypothyroidism, and I corrected that, then what you would see is you would see low TSH and you would see low free T4. And that would make sense. If the pituitary gland isn't secreting, then you're not going to see any thyroid gland activity, so you wouldn't see free T4. The next question, what are the causes of hypothyroidism? So we have got failure, failure, failure. We already said iodine deficiency would do it. And the number one cause, like I said, in the US is Hashimoto disease. Number one cause globally is going to be iodine deficiency. The last question is select all the symptoms you would see with hypothyroidism, so low. We know that from the thyroid hormones we get increased basal metabolic rate. We're going to be increasing oxygen usage, burning sugars, making ATP, and that calorogenic effect. So you're going to see cold intolerance, mental sluggishness, and a low metabolic rate. The other thing that is seen with hypothyroidism is a puffy appearance and swelling, and this condition is called mixed edema. So mix means mucose, so the mucose membranes, and edema means swelling. So you get kind of a puffy-like appearance. This mental sluggishness that occurs just from being tired and not having enough ATP, not having enough energy, in the case of hypothyroidism is reversible. So once somebody gets hormone replacement therapy, they're going to be good. Previously, we were learning about how hormones interact, and we know that for growth hormone to act, thyroid hormone has to come first, and then growth hormone can act. This is particularly important in the case of neonatal hypothyroidism, and that's where you get failure to grow and failure to thrive. That mental development does not occur in those children because of a lack of thyroid hormone. And those developmental delays are irreversible in the case of neonatal hypothyroidism. Like I said, that's because the permissive effect, thyroid hormone has to be present for growth hormone to act. There you go. If you have questions, just ask.